Hey guys, Tony Maritato here, licensed physical therapist, and in this video I want to answer a question from my Facebook group, Rotator Cuff Repair Support Group for Kind People. Gail in the group asked, quote, "I'm 4 months post-op, biceps tendon repair. I have full range of motion but still weak 3 out of 5 strength levels. My insurance says I don't need therapy anymore, so it stopped about 2 weeks ago. This is very upsetting. I can go to the gym, but I tend to overdo it, and I'm having a hard time with muscle pain over the last 4 days. I did a lot of stretching and some light weights. I hope to improve as quickly as possible." So that's a great question. You know, it's one of those things where we're always trying to manage our personality as much as we're trying to manage our injury or our rehabilitation. I know that there are certain things that I personally am going to overdo at times. I'm going to push through the pain, probably to my detriment. And so what I try to do, I'm a physical therapist, but I'm also a human. I get injured, I have problems. I try to find ways to satisfy the urge to overdo it, to push myself, to feel the value of the workout without sacrificing the body part or condition that I'm trying to rehab. So if you're in a situation where you're dealing with a biceps tendon problem, some weakness, some pain, some inflammation, obviously biceps tendon, it's an upper extremity muscle, crosses the shoulder joint. Maybe look at things that you can do for the lower body, for the abdominals, for the back, for the glutes, for other muscle groups that will still benefit the biceps tendon recovery, but won't impede or overuse a weakened tendon or muscle. I usually find that changing my workouts a little bit, even to the point where if you think of the bicep, so the bicep has 2 primary functions that I usually address. It flexes the elbow, meaning it brings the hand closer to the shoulder, but it also flexes the shoulder, meaning it's involved with overhead reaching. So if I do things like a pull, if I pull down, if I pull back, if I do things to work the tricep or the opposite muscle group to the bicep, I can still get that good workout feeling. I can still feel like I'm doing something, accomplishing something. I can move loads in higher repetitions without causing the inflammatory response in the bicep tendon itself. So I know that you're not working with your physical therapist any longer. It is the end of the year. There is a chance that your insurance coverage will reset, and perhaps you can get a new evaluation with the same physical therapist if you liked the experience for related conditions, not necessarily post-surgical physical therapy, but maybe just a tendinopathy problem that you're dealing with. In either case, my best recommendation is look at finding the things in the gym that still give you that level of satisfaction, that make you feel good, without overworking the bicep tendon, and give it time. Bicep tendon repairs are long rehab processes. You're at 4 months. I would tell you that my clients are typically looking at 6 to 9 months before they really kind of feel back to normal, 12 months before they're improving strength and really kind of able to function at the level that they want. So different surgeries have different outcomes, obviously, different age groups, different fitness levels for the individual. But I would tell you that give yourself time, find the other things that you can do that you enjoy, that give you the same satisfaction. And thanks so much for asking the question. I'm sure this information will help other viewers.